with cravings, mood swings, cramps, or just feeling off before your period, then you're definitely not alone. But there is one supplement, and a bonus one I'll tell you just now, that I recommend you take the week leading up to your period that could potentially make a big difference. And it might just be your new best friend. If you guessed magnesium, then you would be right. But not all magnesium is created equal. And taking the wrong type can not only be ineffective, but it also may be a waste of money. I'm Dr. Carmen, an integrative GP and super passionate about women's health. And on this channel, I help you understand your cycle so that you can work with your body rather than against it. And in this video, I'll be sharing why magnesium is my go-to supplement for PMS symptoms, menstrual health, and women's health in general. I'll tell you about some of the different types of magnesium and which is my favorite for PMS, as well as how to take magnesium effectively, and we'll touch on some magnesium-rich foods. So if you deal with problematic periods, then this is for you. Firstly, why is magnesium so important in the first place? Magnesium is a key player in over 300 different biochemical processes in your body. It calms your nervous system, relaxes muscles, it helps to reduce inflammation, and can even help to stabilize blood sugar levels. But specifically for PMS, it's a potential game changer because it can help to reduce prostaglandins. Prostaglandins are hormone-like chemicals that are released around the time of your period to cause your uterus to contract to shed the lining. High prostaglandins means intense contraction of the uterus, which leads to intense pain. So magnesium, helping to reduce prostaglandins, helps to also relax the uterus and reduces period pain. It also can help to support mood and reduce bloating, which are super important around the time of your period. Now, while a severe magnesium deficiency through diet alone is extremely rare, there are some telltale signs that may point to a magnesium deficiency. Symptoms like muscle cramps, severe tiredness, irritability, restless legs, which can have an impact on sleep, a loss of appetite, nausea, as well as muscle weakness can all point to a magnesium deficiency. And specific to PMS, headaches and migraines are more frequent with low magnesium, as well as a craving for chocolate. Yes, your craving for chocolate may actually be pointing to a magnesium deficiency, especially if this is happening around the lead up to your period. Cacao, which is present in chocolate, has a very high percentage of magnesium. So it could actually be your body trying to communicate to you that it needs more magnesium. Now remember, if you are having any symptoms, it's always best to speak to your doctor about getting a diagnosis, rather than guessing what your symptoms mean. Now, if you've been thinking about supplementing with magnesium, you may be overwhelmed to see just how many types of magnesium there are. And it's true, there are many. So let's break down some of the key types of magnesium, and then I'll tell you which one is my absolute favorite for PMS. Before we do, it's important to note that the magnesium in all of these supplements is the same. Magnesium is magnesium is magnesium. The magnesium does not change. It's how the magnesium is prepared and what it's prepared with that actually changes how well the magnesium is absorbed and the potential benefits. For example, magnesium citrate is magnesium paired with citric acid. Magnesium citrate has a high bioavailability, which means it's absorbed really well and it's easy for your body to use the magnesium once it's absorbed. It's sometimes used as a laxative because it can increase bowel movements, and sometimes it may cause loose stools or even diarrhea. Now, if constipation happens to be one of your PMS symptoms, then this type of magnesium may be helpful, but it's not my favorite. Magnesium oxide is another very common type of magnesium that is often added to many supplements. The problem is it's really not well absorbed at all. It's a cheaper form of magnesium, but the absorption and bioavailability is very low. In fact, some sources say that it's only about 4%. So you really aren't getting much benefit from magnesium oxide. Magnesium taurate is a type of magnesium that is paired with the amino acid taurine. And magnesium taurate is thought to be helpful with your heart health and your blood pressure, and may even help to reduce blood sugar. Magnesium malate is magnesium combined with malic acid, and this magnesium tends to increase your energy levels and may help to reduce muscle cramping. Magnesium L-threonate is a unique type of magnesium that has the ability to cross the blood-brain barrier. So it's been shown to help boost mood, reduce anxiety, and improve cognitive function. Magnesium sulfate is Epsom salts, and it's usually used in baths to soothe sore, tight muscles. Now, the effect of this is most likely also due to the fact that the bath is usually hot, and heat also helps to relax muscles. And the absorption of magnesium through the skin in this way is very minimal. And so you're unlikely to have any generalized effects of using magnesium sulfate. Now onto my favorite type of magnesium, magnesium glycinate. It's magnesium paired with the amino acid glycine. It's very well absorbed and highly bioavailable, and it's gentle on your stomach. So it doesn't have that effect of diarrhea or loose stools like magnesium citrate, which is very helpful when you are already feeling bloated, or even if you experience what's known as period poop, which is a diarrhea or loose stools associated with your period. You don't want to be making that worse with your magnesium supplement. Magnesium glycinate has a calming effect, so it can help to improve sleep, help to stabilize mood swings, and reduce any anxiety that may be related to PMS. And of course, it helps to reduce muscle spasms, so it may help to improve period pain. Now, of course, while reaching for a magnesium supplement may help to reduce your PMS-related symptoms, it's always helpful to try and boost your magnesium levels through your diet. So some examples of magnesium-rich foods include leafy green vegetables, such as spinach, nuts such as almond nuts and cashews, seeds such as pumpkin seeds and chia seeds, legumes such as beans, whole grains, avocados, bananas, some fish like salmon and halibut, and of course, as we mentioned, cacao. Now, when it comes to cacao, the purer the better. So cacao powders or cacao nibs or even dark chocolate are preferable. Most of the chocolate that we find in stores nowadays is very high in sugar and unfortunately has very little cacao in it in the first place, which means that the magnesium content is going to be really minimal, if any. How should you take magnesium for PMS symptoms? It's advisable to start the magnesium supplement about 5 to 7 days before your period starts. And typically women do well with a dose of between 200 and 400 milligrams of elemental magnesium. Now, don't get confused. Some supplements may say that they contain 600 milligrams of magnesium or 1,000 or 1,500 milligrams. What this is the combined amount of magnesium with whatever it's combined with, so citric acid or glycine, for example. So when you're looking at the labels, look at how much elemental magnesium is in each dose. And this is where we're looking at between 200 and 400 milligrams of elemental magnesium daily. It's super important to speak to your healthcare provider before you start taking any new supplements, especially if you are on chronic medications or if you have any chronic medical conditions. You may find increased benefits taking your magnesium supplement at night, just because it can potentially help you to calm down, relax, and it can improve sleep. Plus, I did mention a bonus supplement. So for PMS in particular, it may be helpful to pair your magnesium supplement with a vitamin B6 supplement. Vitamin B6 is also known as pyridoxine. So about 100 milligrams of pyridoxine combined with magnesium may further help to improve your PMS symptoms and improve mood symptoms. So PMS does not have to hijack your whole life every month. And while magnesium is not a miracle cure, it is a useful tool to have in your hormone health toolbox, especially if you use the right form, in the right dose, at the right time. It's a small tweak that can potentially make a big difference in managing your PMS symptoms. And remember, speak to your healthcare professional before starting any new supplements. And while supplements are fantastic, they are just one piece of the puzzle. If you're having period-related problems, then you may find this series on lifestyle changes for hormone balance helpful. I'll see you there.